Hello.
Hi, Carrie.
Good evening, everyone.
Okay, I think we're all here. Paula has a conflict tonight, and so she won't be joining us. We'll probably get started. I decided I was going to, it was so warm out, I took my grill out this week, and then tonight I was going to grill tuna, so I bring the tuna out to the grill in this freezing rain coming down. Horrible. Horrible.
Came back from a walk. It was sleeting or hailing or
Yes.
I don't know what it was.
Yeah, cold. That's all.
Yep, yep.
All right, so I'm going to call the meeting to order. Just usual items, public comment. We'll review the minutes from the last meeting. Kevin, give us a coalition update. Peter and staff, the monthly health division report, which just got emailed if you haven't seen it. And then we give follow up on the grant program from Jean and also on the influenza update. Couple updates on the health director position and where we have to have a discussion about where we're going to go with the internal analysis issue. And then the usual COVID updates, and then a wrap up. So that's it for tonight. So before we get started, I just wanted to share with everyone this email conversation that Peter and Jean and I had about what happens when one of the board members can't make it, like Paula tonight. And just as a kind of interesting background, just for future reference, turns out that that in order to have a board meeting, we have to have a quorum, that we have to have at least two of the three full board members present. And if only one is present, then there can be an opportunity to elevate, quote unquote, an associate member to a full board member for a quorum purposes. And so interestingly enough, that, and you certainly have to have a quorum, not only have a meeting, certainly to have a vote, if we were going to take a vote. I don't think there are any votes tonight, but we'll see. And interesting, Jean pointed out that that if you elevate, so to speak, a associate member to being a member, they remain a member, and the member who wasn't there becomes an associate member unless the board votes in reverse at a subsequent meeting, which is not something I was aware of.
Can I just jump in for 1 second?
Sure.
One slight tweak.
Okay.
It's when you elevate the member on a topic or on a matter.
Right.
So if someone was gonna move up on, the grant,
Yep.
then any time future votes, that person would be the person
Oh,
voting on the grant. So it's on the subject matter.
On the subject matter, right.
Yeah,
So it's even more
it's confusing.
arcane. Okay.
Yeah, so they kind of hitch their wagon to that particular
that issue.
topic. Yeah.
Yeah.
And apparently the bylaws also specify that the associate member to be, elevated if that was needed would be the person who was most senior in terms of duration on the board. And so that's another little pearl that I wasn't aware of. So anyway, that's just food for thought in the future. I don't think it's going to impact tonight's meeting. I don't believe we have anybody from the public on. And you didn't get any emails or anything?
No, I did not.
Okay. We can go to the minutes, which got sent out earlier today. Looked okay to me. Any amendments?
I had none.
Okay.
None from me.
Okay. Motion to approve the minutes.
Second.
Carrie?
Second, yes,
Okay,
yes, I,
Aye, and Rick, aye. Okay, minutes are approved. So Kevin, there was an advisory, coalition advisory meeting yesterday or something?
Yesterday, yep, they have it at the end, the fourth week, typically, every month. So it didn't have a whole lot to go over. There's some things that probably just aren't relevant to the crossover between us and them. So I just wrote down the things I thought you folks might want to hear that they have going on. They are getting ready to send out their 2021 Youth Risk Behavior Survey. So this is something they send out every year, and it goes out to middle and high school kids. And this year, and in typical years, it's trying to assess, you know, what they feel like, and they're trying to get honest answers from the kids. What are the issues at the high school from substance abuse? Do they abuse substances themselves? Do they see it used? So it's a lot of it is kind of based around that typically. This year, obviously, however, there's a lot of questions that are COVID related. So it should be interesting data to look at afterwards when they get that back. I'll be sure to, when that's available. I don't think it's going to be available for everybody until like the end of May, June sometime. It's going out to the middle school the first couple of weeks of April, and going out to the high school once everyone gets back from break. So they need to get that, send it out, leave it open for a while, compile it, get it back. And I think Erica said somewhere in the middle of June should have something ready to show us in a way of, what this came out with. So a lot of this helps them, drive, okay, where do we feel like we need to help the kids, and where are we seeing a change in pattern from one year to the next out of these surveys? Is things getting worse, getting better, in particular different areas that they have and the questions that they ask. So it's a big survey that they do, and really drives a lot of their attention to, okay, what are we doing moving forward here? So I think you want to hear about that.
Can I ask you,
Yeah.
does it include questions around anxiety, depression, suicidality, bullying, sort of mental health, behavioral health related issues?
I do want to say it did. I'm trying to remember the one from last year. I want to say it did. I know it's definitely going to have it this year, because that's going to be a lot of the COVID related
mhm.
discussions is going to be around mental health, and things about feelings of a lot of being alone and kind of isolated, and so that it's going to be kind of looking into it from that perspective. So I know they will be this year, but I want to say they did have it last year too, Rick, if I remember correctly.
Yeah, that's my understanding of how the survey is constructed.
Yeah, Kevin, do you know how much, if any, input that we get into the survey? Because it's a national survey, right? It's a CDC-based survey that gets administered at the state level, right? And then local.
It's a good question. I don't know the answer, Jerry, directly off the top of my head, but the way Erica was speaking, she made it sound like that's not the case. She kept using references. Erica McNamara, being the director, she kept using references saying, "I'm glad they had this in there this year," right?
Yeah.
So it was the way she. I didn't ask her that question there, but the way she was talking, it almost seemed like it's like you said. Here you go, send this out, and let's let us see what the feedback is.
It's been a little while for me. I'll just add to that, but I believe that it used to be that there were opportunity to add a couple of questions, or to modify to local circumstances, a couple of questions. But it is a national survey, and for validity and the like, the questions are all conformed. So
Yeah.
I think there's a chance for a little bit of customization, but not a ton.
Yeah, it'll be very interesting data.
Yeah.
Yeah, this year is going to be really an interesting one to look at, and especially look at it over the last couple of years, side by side.
You should think of having Erica come when the results are available and give us a little presentation.
That's a great idea, actually. Yeah,
I would
yeah,
love
she can give
that.
a nice presentation on it. So look for that for June from a meeting agenda item standpoint, Rick.
Okay.
There's they're doing the ongoing work right now. Obviously, in the schools, they're working with the SROs. That's a school resource officer, for those not familiar with that term. And right now, we're going to be working with the 8th grade coming up to do an in-person presentation. We're actually very excited about being able to do an in-person presentation with the kids. That they get a lot better feedback out of it that way. And it's going to be a substance misuse presentation that they're going to be doing collaboratively with the SROs with the 8th grade. So that's something that's going to be coming up in May that they're going to be working on. And the other piece I thought you folks might have some interest in is, again, the Doc Wayne. If you remember, I brought that up a couple meetings back. Great program working with kids to help resolve their own issues that they may have with being, as far as simple things as working in a group environments and understanding, how to handle different scenarios as they come up a little bit better and a little more productively. So they're trying to get, it almost feels like we just don't get the traction out of this program. I think you're not getting the buy-in from the parents to want to put their kids in this program. But I would figure this year more than any other year would be a good year to have it. They're looking to program with Doc Wayne and the YMCA and get something up and running for the summer. Something to do for the kids in programs, sports programs, and all sorts of different things to try to get that up and running for the summer. So they're working with that right now, trying to get something together. They'll probably have some more information at the next meeting, I'm sure, a month from now. But that's really it. It was really a pretty brief meeting. It was only about 45 minutes long last night.
Good, thank you. It's helpful. Peter, monthly report?
I sent you the monthly report and I had to wait till the 11th hour here. I didn't have the data until then. And I mean, it's okay with me. I could even hand it out. In fact, that it just got altered. I just heard from John Freilich right after this meeting began, and he turned in some more inspections that he did. They're due from him by the close of business on Thursday. So at least every other week. So that's a glitch. I'm going to share this screen here if I can, and you can see some of the amended pieces of it. I just went up by 8 inspections. Can you see this piece?
Yes. Can you?
There it is.
Yes. Oh, yes.
Okay, so the epidemiology section will get filled in later today by Schwang, and Christine just sent us an email. She can't make it tonight. She was at the staff meeting earlier today. She's suffering from a migraine right now. I feel bad about that. I used to have the same thing. And the darn things went away one day and I never saw them again. I hope I never do, but for years, I was out like a light a couple times a month. So we'll fill those blanks in as we go along. The environmental piece is a little bit more straightforward, so I'll talk about that one. The red numbers, obviously, as I mentioned, are the updates. So, and Daniel gets credit for helping me out a lot with this. So he pulls it all together, and I just patch it up as I see fit. I'm using the 135 over here as the T, a total number, and measuring everything against that. But apparently for this current month, we've got 42 new applications returned and issued the permit to them. And I mean, I wish I could spend more time with Daniel to get a feel on, what is he counting and so forth. I'm assuming that these are food establishments, but they could be dumpsters, they could be any old thing. So still the 135, and we're still figuring it out. So the total number of inspections in this current month were 26, in which 14 were done by Dan and 8 were done by John. See, Dan did an additional 8 inspections, and I think he's talking about out of this 14, he had to go back and double check on 8 of them, which is a good sign to me that he's being thorough and not just walking in one door and out the other and saying thanks. So if that is the case, then the total for the month for Dan was 14. The total number for John is 12. That brings us to nearly 20% of our annual inspections done since today, for the first quarter, January, February, March. And that's, pretty much on target, a little bit behind, but not nervous about that. The total number of inspections,
Peter, can I
Yes.
just ask,
yeah.
if, so the total number of inspections that we would expect by December 31st would be 270, correct? 'Cause they're-
Yeah, if going by what I think this means, it would be, that's correct.
Right, and so it'd be 135 semi-annual, so it's
Right.
270.
Yeah.
60 have been done year to date. So actually, the percent done year to date is
Half of that.
over 270, which is more like roughly 25%, not 44%.
Yeah, but I
Right.
would go half year at a time because we're out of compliance. If when the half year mark comes, I mean,
Yeah,
on July
I-
1st, I roll everything back to zero.
yeah, I think 25% in the first 3 months seems to me to be right on target.
Okay, yeah, thanks. Yeah, thanks for clarifying that, Rick. That does make more sense than my number.
Okay.
So there's that, some new pieces. Daniel seems like he's a good inspector. I wish, again, I'll say, I wish I had more time to spend with him and so forth, get him really up to speed. But, he went back a third time because there was a delay to receiving the parts. So that means he's really doing his job.
Mhm.
He's going in there, the people, I think it was a refrigeration item, and we had them get ice and pack some of their product in the ice to make up the difference between what is required and what their equipment could provide. So there was a delay again, and he went in there. Let's look at Dennis for a second. Dennis Palazzo is our new contracted inspector since he got in here after our last meeting, when I was authorized to do something about some help. He's hit the ground running. Things were starting to stack up on him. He's got 4 plans on his desk. He's been over 3 of the 4. The 4th one, he knows what's going on. We have some issues. We'll tackle those, in the next week or so. Apparently someone wants to open a new food establishment and their refrigeration is inadequate. We have a form that we use that was been provided by the federal government, the FDA. And based on the number of meals expected to serve, we need to know how much cubic feet refrigeration and freezer space we have, how much linear space of dry storage and hot water capacity, things like that. Besides the types of materials that you're using to construct and the equipment, those basic pieces, we don't want people running out of storage space or refrigeration, freezer space. So this is a little bit different than what I think Reading has seen in its food plans, and we're going to slowly be implementing this. There's plenty of cities and towns that are using what was once known as the Blue Book to come up with these numbers rather than the code says adequate.
Mhm.
So have adequate refrigeration. Now we can put a cubic foot to
Yep.
refrigeration, so we know it's adequate.
Mhm.
And that's what Dennis is doing here. I'll toss this out for a primer. When I left Danvers, we had a local regulation that required all new food establishments to develop a plan that then had to be reviewed by someone with Dennis's credentials before it came to us. So we're not doing all the work. It takes a long time. And you might have to interview the people on a few occasions too. So we know that how many, what's the menu going to be? What are you looking at for ingredients coming in? That should all be done before it gets here.
Yep.
And I came up with that idea because I was doing septic system plans on my Moon Lake time. And gosh, they were so comprehensive. They were a pain in the neck. It was okay to do and stuff, but the local boards of health going up county in Topsfield and Middleton and Groveland and so forth They just wanted to see so much detail, they're revising them 3 times before they're done. There's no body count with wastewater. Why aren't we using the same set of criteria for food establishments where there actually is data that says,
Right,
if you don't do it correctly, you're gonna make people ill.
Right.
So my board in Danvers agreed that we should have a professional review the plans before they submit it, and then we could provide the oversight in case the professional, we could question the professional. I mean, people in Reading, and this is not a put down or anything, it's what happens. You know, they ask a lot of questions. How many, what kind of ceiling tiles am I allowed to use? And it's like, okay, we'll design this of the darn thing. We can't be doing that and giving everybody what they want. So
Right.
at some point, you guys might recall this conversation again, when I come to you and say, let's get a vote for a local regulation, Board of Health regulation that would require a stamp of a professional on the plans coming in so that we can free up the hourly workers to do what we need them to do instead of designing some entrepreneur's plan.
Mhm.
All right, I think you tuned into that. We had one body art practitioner that got a new permit. That's the only one I'm aware of. And we had 4 complaints that I'll break down below. And so we move right to that. Now you see a new name here, Jean, not Delios. We have a Jean Marcotti who began since the last time we met. And again, she worked with me in Danvers and she lives in Stoneham. She said she could help us with the inspector of animal duties. And she's not officially sworn in yet, and pick on Jean for a moment, but we should get that paperwork, Jean. I know you have it, you mentioned it to me, and probably get her to fill it out and get that on file. But she's had a dog bite complaint I might have mentioned to you once already, and she's released that since. We'll get reports from the veterinarian in the area when they treated a household pet for an injury that came from an unknown source,
Mhm.
just so we could track them, and they have to be quarantined for 30 days before we can release them. If the shots are not up to date, they have to quarantine even longer. So she's doing those things. She had 2 of those to go through. And I've had a request to approve a plan to raise chickens. And I haven't done this one before.
No
think you were
chickens
putting it in
in
place in
Danvers? I
Danvers,
can't
but-
believe it.
Yeah, I know. No, it was open house in Danvers. If you wanted chickens, raise the chickens.
Oh, okay,
If you make a mess, someone will come down there and tell you, get it out of here because you don't know what you're doing. So
okay.
it was not proactive. I think since then, in fairness to the town of Danvers, in fact, I believe it was the town meeting after I left, they finally came up with an idea that Reading has. So in this case, you guys are ahead of the ball. You came up with chickens. You need to go back and catch up with the food establishment, but we'll all be on the same page eventually. And this, by the way, is what drives contractors crazy. Go to one town, you don't have to do this. Go to another town, you have to do this. So
Right.
try to keep it as even, Steven, as we can. So that's been our month so far, as best I can figure, except these 2 complaints here under other, these are COVID complaints. I suppose we should get another line and put something down about infection control, maybe that wouldn't be epidemiology, but people call in. The most recent one wanted to be anonymous. They were in a retail store and said nobody was wearing masks. They were wearing masks, but they all had them down below their chin.
Mm.
Can someone go in and give them what for? And we said, all right, we'll go take a look and we'll offer them some information that will help them. Now, this section here is on our agenda, the public health emergency preparedness, and we'll be going over that, so it's redundant to talk about it now. But under the community health prevention and promotion, we just heard Kevin's report, and that's a great one. We will see again and hear from Schwang shortly. And I don't have anything that would fall under this category at this time. But I will also state that under staff development activities, there are at least two really good stories. And one is Daniel has got his paperwork in. I've been saying this since I got here, let's develop the staff. And he is qualified to sit for the RS exam. In the world of public health right now, or environmental health, that's kind of shifting from registered sanitarian to registered environmental health specialist.
Yep.
And so that's what you see here, the RS/REHS. And the National Environmental Health Association is our professional organization at the national level. We also have a state level too, that used to cover us for the registered sanitarian. And that's a story I won't go into right now. But the important part is Daniel and the town have committed to taking this exam. We're paying for the fees, the town is. Daniel did his application, which is comprehensive. Got to get his grades in from his colleges, all his transcripts and so forth. And he should be sitting for that exam this summer. And if that becomes the case and he is successful in passing it, we will have a registered sanitarian / registered environmental health specialist on staff. And I'm looking forward to that day when our new director comes in with an MPH and doesn't have to be a specialized RS, somebody in environmental health on that piece. Doesn't have to be a registered nurse. That's another piece of it. So the second part, the second bullet down here is our IT group. Well, I say this so often, I start to feel as though I'm a shallow person, and I really am not. And I'm usually more critical than I find myself since I've been working in Reading. I thought I was turning grumpy and old, but I mean, I'm turning cheerful and old because, and this is directed not entirely at, but partially at Jackie and all her working people. We have a staff of administrative assistants that are really incredible. I've never seen anything like it, and I've said this before. The latest one, I worked with a woman today that I only met for a couple minutes. Her name is Kim Saunders. I don't think I could pick her out in a lineup, unfortunately for me, but she's got a pleasant voice. She answers that phone on a dime. She's helpful as can be. And she and I spoke this morning for maybe 30 minutes about how we could improve our electronic permits. And I said, wow, that's exactly what I was talking about when I got here. I thought we had more in place than what we do. You know, time goes and we began some of the stuff with the COVID addendum that was put online. I don't think that was before I got here, but now we can track it online. And she says that by the time I get back in the middle of May, we'll be ready to hammer out the details of getting all these other things that we permit into that same system. So I think that's progressive. I thought it was worth mentioning, and I'd like to be able to track it with you folks on how are we doing with our electronic permitting. I think if we went back to the minutes, I might have mentioned it back in November or December when I was just getting my feet wet and can't do it. But this one has got I have a high priority for this as well. So I think that's my report, except for the nurses pieces. And, you know, any questions you have, let me have it and we'll try to figure it out. Yes, Carrie.
Just so applaud Daniel for doing the work to get his application in for that. I know it's not just filling out a little form. It's a lot of work. And good for him for, you know, having the desire to advance his skills and improve himself and get that credential. And thank you to the town for being willing to support that. I think that's wonderful. I'm glad to hear about the electronic permits. I know I was asking Jean about some of that stuff in the summer, and I know it's not the simplest thing to migrate to a different kind of system. So thank you all for the persistence, and I agree. I mean, the staff that I've gotten to work with at Town Hall, it really has been a pleasure, and I'm glad that you're kind of lifting that up, Peter, because that kind of stuff tends to be invisible and not noticed, and that's good.
Can I just comment once, in Gene's department, everybody else, I'm not putting anybody down that preceded me, but it's apparent that the building inspector and all those folks, they're all doing this. When I got here, there were cheers coming from IT say, oh, goody, we're gonna get somebody that wants to help catch up with building and so forth. And
Yeah.
we just started it when the distractions began and
Yep.
just putting out the fires, as they say. Anybody else?
Sorry, one other thing I know. So do I see that we have 3 body art places and we have 1 new one? Or,
No, that's a body art practitioner. I
okay,
can't tell you how many body tattoo shops we have. I don't know.
I think we just
no.
have 1, because I
Well, we
think
might
we
have 3
did the,
practitioners within that one.
yeah,
Because this number 3, he went through a lot of trouble to try to get it. And
Yep.
they were heavy into me saying, we're losing business every day. You're dragging your feet, not getting this. Yeah, you gotta be able to prove that you know what you're doing. Come on.
yes, yes. Okay. Thanks.
That's great, Peter. Any other questions or comments?
Great stuff, great progress. Thank you.
I mean, it's only counting. And I think there's probably, when you go in here, I'll find tons of flaws when I'm in there pushing papers around and pencils, like I made a living being a pencil pusher.
And it's, Peter, it's counting, but it's also, there's a narrative
know.
that kind of gives us a picture of what's going on in the town.
Yep.
That's important.
I know it is, but it could get clearer, and I can become a little bit too as time goes on, but we'll try to check it. Okay,
Yeah.
Okay,
Good.
good.
Thank you.
Thank you.
certainly welcome. Thanks for your time on that, interest on that. That's nice. All right, so now I'm gonna send this back somehow.
So
I can do
you have
that.
to unshare your screen.
Yeah, I'm looking for that. Anybody
that-
want to say something about it all? With the
Yeah, I get
instrument.
lost on this one. So go down and find your green arrow. Is
Oh,
it on
here
the
we go, I
bottom,
got it.
maybe? Yeah.
Screen sharing, there it is, and say unsave. Hmm,
No,
Well-
not fixing.
Did that go away?
No.
No, you have to, down at the bottom of your screen, it says participants, chat, share screen.
Yeah.
The share screen, I think, is what you click.
This, it says I am screen sharing. Did it go away?
So now
All right.
stop.
Right.
Yeah.
How do you stop?
New share.
Peter, try clicking the green bar at the top of the screen.
Yeah, I am. It's giving me, oh no, there's a box above the green bar. That's giving me everything that's open on my screen, and I want to close that. So that the X isn't doing it.
There should be a stop
How
share button.
distracting is this? Totally. Minimize it, maybe.
Can somebody take it back? Who's the host? They can just take it back, I think. Well, I don't know.
Your screen sharing is paused.
Yes, it is.
Stop share. Here we go.
There it
There you
is.
go. All right.
I'll blame it on Florida. The service down here is peculiar in some
Yeah,
days,
yeah.
better than others. Okay,
All right,
back to the agenda, Doctor.
thanks. Thanks, Peter. So Jean, I want to give us an update on the public health grant we talked about last time.
Sure. So we, after we met a couple of weeks ago, the very next day, the state submitted some Q&A information and reversed the interpretation that they provided at the bidders conference that I had attended. And so the guidance that was provided at the bidders conference was that 2 communities could get together and apply as a region. And that's what we did. And then subsequently, they posted a clarification that they reversed that. And they decided that it wanted to be 3 communities or more. So that was on Friday, March 19th, the day after this board met and voted. And 2 days or 3 days before the town of Linfield's board was meeting, which was on the Monday. So that was an interesting position to be in, having to go before the Linfield Combined Select Board and Board of Health with guidance that changed a couple days before the meeting. But as we have all learned through this pandemic, things change and resiliency is key. So we went forward and discussed the idea of continuing the path forward with applying for the grant and trying to see if we get a third community. And in many ways, we already are doing some shared services with the town of Wilmington. They provide service to the town of Reading for the very infrequent need to have some assistance with septic. So we are already engaged with them. And Linfield is very much engaged with Wilmington on that front and I think a few other things. So in a way, it wasn't that bad to have to regroup and come up with an application that would meet the criteria now that it had changed. Sadly, it was right after this board voted, like the very next day. So that's what we did, and we put together an application and filed it yesterday. And we requested 500,000 to add staffing for nursing, inspections, and some other admin and management resources. They very much wanted a coordinator to be funded in the budget. So we funded that. It's more of a higher level admin, but then also we know the value of having support staff and the awesomeness of Jackie and having people that can do administrative support is essential. So we asked for that as well and put it together, and that's where we're at. We will find out. We're told that the state is going to make a decision May 1st. Like everything else, that could change, but that's where we're at.
And that 500,000 is over 3 years
Yes.
total.
Yep. It's 50,000 in startup costs, just some miscellaneous things to set up an office, furniture and whatnot, and then 150,000 a year for 3 years.
Good. Thanks
Okay.
for,
That's great.
What do you see as the probability of us getting it?
Well, it's funny that you asked that because I of course have I've never written one of these before. I've never applied for a grant to DPH. Like so many things, you just jump in and you do it. So I thought, well, that and, we're really just starting this conversation with the beginning phase of exploring this idea.
Mhm.
So as a planner, that's not really when you think you're going to be successful, when you're just starting the conversation. There are, I'm sure, are other communities that are much further along, have had much more opportunity to give it some more thought and think about it. So for those reasons, I wasn't very hopeful. I'm always hopeful, but I didn't think it was very likely. There are lots of other communities that have been at this for a longer time doing this kind of thing. The silver lining to that is it starts the conversation. And as Peter has said, it brings Reading to the forefront of what's going on in public health in the state. And to me, that's the bigger win really than anything else. And there's going to be lots more opportunities if we aren't successful. So being out front and being shining a light on all the good work that's being done in Reading and how hard everybody's trying, I think is the best outcome that we could get. Certainly if we got the money, that would be even better. So it's really hard to say. I will say that, in talking to a few other people I know in public health, they were a lot more positive and thought that a lot of communities are going to be applying sort of at the edge of what this grant is intended for. This grant is intended to be a shared services grant, not, we'll surgically introduce this piece and we might have a corner of that piece and we'll knit it together and it'll be kind of a shared thing.
Yeah.
So the application I wrote says we're going to share services. We're going to pool resources and share services. And so we may have a better shot than I think. I don't know.
I don't have to say. Carrie,
If I may, so I do a lot of work with the Office of Local and Regional Health, who are the sponsors for this particular grant program. And Jean, Jean's exactly right. And the priority is to support communities as they advance the efforts to look at sharing services. This was a key recommendation out of the Blueprint for Excellence from the Special Commission. The sharing of services has been an administration priority for longer than this for other disciplines. And there is a real desire to make it possible for communities to be able to do this. People have identified the barrier is we don't have planning dollars. We don't have time to make proper, thoughtful arrangements. And so there's a real desire to fund that kind of thing. So I sit with the optimism, but I also know that, as Jean said, there's a lot. I think they said they'd do 30. They were hoping to do 30, right?
Mhm.
And there are, 351 communities in the state. And as you said, there are other folks who are engaged in this, but I think 100% Reading putting themselves on the list and indicating to the state that this is something that they're serious about pursuing is a good move regardless. So well done. And I guess, they said they tried to make the grant application not too burdensome. I hope that was the case. No, from your perspective. Well, see, that's the thing, because from our perspective, some of the stuff we have to do for federal grants is just nuts, but how it translates from discipline, from department to department is very, very different than, gosh, what we have to do for PDC and HRSA and other things is a lot. But okay, so thank you for doing all the work.
Thank you to Jackie. She could figure out how to they created these little boxes that you had to fill in with the narrative.
Yeah.
And then you had no ability to edit it, spell check it. It just sat in a box. And
Yep.
I finally had to go to Jackie. I said, Jackie, help me. And
Yep.
she knew how to cut and paste and do some other magic and edit it. Because anyway, yeah,
Nope. Yep.
we got there. We got there.
Yay.
Good job.
Can I add one thing, Mr. Chairman, Dr. Chairman, that is, and, so the question on the table, what do you think the probability of us getting this is? And, Jean's not a public health person, but she's smart and hardworking. There's a lot to be said about the saying of out of the mouths of babes. I think she's onto something. We've done our homework extraordinarily between Linfield and here. And the only other thing I would say is that just by the timing alone, in these last 2 weeks, I've had opportunities to talk to really high level people at the state about our vaccine program. We might see some body language go on with her, but we've done things with FedVax that the rest of the region said, well, we're not touching that with a 10-foot pole. They all think, when I meet with them on Tuesday mornings, they think that Reading, why are you deliberately trying to over achieve? And it's because of I'm not trying to overachieve. The fire department might be trying to overachieve. The nurses might be. I just think that there's a lot going on that is very good in Reading right now.
Mhm.
And good luck might be on our side as far as that message going right up to an assistant commissioner. I got her name down here. Terry might know her, but one I actually knew from going way back. Clark. I don't really like to drop names, but the point is, we're doing things that are requiring just a little bit of innovation. more than creativity, it's innovation to get vaccines in people's arms where the rest of this area is out of the vaccine business altogether. Can that help us? I'm not sure. But between Jean's hard work and her ability to write and what's happening the rest of the place, on the rest of the programs around here, Swang is doing a heck of a job too. I think I'm starting to feel that this is someone's gonna recognize us and throw us a ball and say, give it a try. Let them try.
Good.
I'm gonna be
Right.
I'm not gonna fall out of my chair if it happens.
Carrie?
Yeah, I'm sorry, I forgot the other thing. I could offer some clarification on the wheres and hows of why the 2 changed to 3. So 3 had always been the recommendation. 3 communities is a better grouping. They believe, because if a community pulls out, you still have an opportunity for collaboration and the like, but there was a really excellent and long-standing effort to do a collaboration between 2 communities out in the western-ish part of the state. And so they said, yeah, we'll make a little space for that. And then that actually collapsed, and sort of confirmed people's understanding that 2 is just tricky, because if 2 fall apart, there's nothing left to fund, and then what do you do? So I think that the implosion of that particular relationship made it this thing. We really need to let it be the 3. And I was looking at the FAQs. I was like, oh no, this is terrible. But Jean was already on top of it, and they had already figured some stuff out. Yeah. So, anyways.
Well, I think that, Jean, you might say that there are other communities that have been doing this longer and are more advanced. On the other hand, maybe the purpose of the grant is to get communities that haven't done it. It's like not let the rich get richer, but help the poor, advance. And so there might be some chance there. We'll see.
Yep. Fingers, toes, all those things.
Linfield is very interested in discussing this idea regardless.
Great.
So
Oh, I can imagine they are.
Oh, dear. That's okay.
Not saying
Me-
anything bad, but I'd be excited if I was them too.
Yeah,
Reading's
Yeah.
doing a lot of good things.
it's good.
Okay, influenza update. Jean, you want to let us know where we are with that?
I think that Schwang's, go ahead, Jean, intro it.
yeah, I think for this agenda item, it's really the idea of collaborating with community partners in the future. And so we've reached out to a couple of different people. Thank you, Rick, for some names that I could pursue. I also circled back to the former, I don't know how many chairs ago, who is I forget which pharmacy he works for, but he's a pharmacist and knows a lot of people in that field and
right,
has access to a lot of people. So we had a nice chat, just chatted on the phone because initially he thought I was talking about something else. So anyway, it's always good to talk because you can actually have an exchange as opposed to email. So we chatted and he said that he would look into it and get back to me. And then I followed up with an email and let Rick know that I had reached out, and hopefully we have another way of finding out some more information about a potential partnership. So that's where we're at.
Brian, did you have an update on influenza vaccines? Did we
Yeah.
purchase that? Or?
I talked with Sanofi yesterday, and we got an reservation confirmation for our order. I'm just gonna share my screen. Can you see my screen?
Yes.
Okay, great. So this is our current order. It's based on the order last year, and since we have 25,000 budget, so we adjust the quantity. So right now we ordered 120 doses for high dose, 260 doses for flu block, and 180 doses for the regular flu vaccine. And we also get confirmed we are contract, we have state contract. So the price right now is $24,371.62. Do you have any question?
Glad to know that we've got vaccine coming.
Good. Okay, great, thank you.
You're welcome.
Health Division updates, just wanted to talk a little bit about where things are with the health director position. Maybe Jean, you can elaborate on that. And then we should talk about this internal analysis we've been discussing for several months and where we should go.
Yep, so I think the fact that we applied for this grant is a little bit of a wrinkle because if we post the job, are we posting it for Reading or are we posting it for a regional position?
Mhm.
So
Is your concern on the applicant, Jean?
well, I guess I always want to be careful that we're clear on what the job is. And the way it's written is Reading, this is a health director for the town of Reading.
Right.
I don't post it, so I guess it's further up the chain that has to figure out how to do whether or not to hold off until we hear back from the grant or to post it and somehow word it that this could be a regional thing. Maybe there's a middle ground there that it can be kind of reworded so that if we do get the grant and if it is a regional position, we're able to still continue with the hiring process with that as a possibility.
So Bob went to the select board and got approval to put this position in the matrix, whatever that is.
Yes, it is now on the classification chart. Yep.
Right. And he, at that point, I think this wrinkle about the grant hadn't really kind of come up, but he at that point said he would be interested in posting it and starting to look at applicants that might come through, but wouldn't make a hire until it was proved at the town meeting is for fiscal year 22. And so, you know, my own sense of this, I'd like to hear from others, is, you know, I would rather post something that's, you know, perhaps it's a little ambiguous, you know, this could be for 1 to 3, you know, towns, and get the ball rolling, because otherwise it could very well be that, as you said earlier, you know, the deadline for the grant announcements is May 1st, but yeah, maybe they'll push it to May 15th or June 1st. And then, you know, if we get awarded it, you know, there needs to be a process to finalize it and structure. I mean, this could all take time. And I just think I don't know what it would take. I mean, I'd be happy to talk to Bob, but I think we ought to be kind of moving on it with the clarification that, you know, it's for Reading, but we've applied for a 3-town grant. It may turn out to be bigger. And frankly, I think that the kind of applicant who would be excited or interested would actually see that opportunity as we talked about as a great one. And so even if we don't get the grant, we might attract, you know, stronger candidates. I just hate the idea of waiting 1 or 2 or 3 months, because this just kind of could go on. And then we hit the summer months and things slow down. And what do other people think?
Yeah. Yeah, I mean, I'd be interested to know how flexible the posting requirements are, and you know how much leeway you have in how you describe the position. I guess, and I mean, I'm curious in how long it really does take to post. I know in the ginormous bureaucracy I work in, it takes a long time to get a posting approved. I guess I'll say that I would be surprised if the funding announcements are delayed. I, I could be wrong, but I know that there's a large amount of money that needs to be committed. You know, so it's that is kind of balancing with do we get the right applicants for that grant program? They need to get those dollars committed and demonstrate it. So, how long would it take to post? I mean, I think it's wise to get it out, but
Yeah, so the writing of the posting, that's been done.
okay,
That was done quite a long time ago. The Bob wanted to go to the select board and have them vote to put it on the classification chart. That happened, I think it was March 23rd. So that was just, a week or so ago. So when I inquired about it today, it was, kind of a conundrum at this point.
Right.
Because I knew we were going to be talking about it, obviously. And I thought, okay, well, this is good feedback and good conversation so that we can make some plans.
Yeah.
But it seems to me you could strike that middle ground and just say this is the job, and as a possibility that it could be a bigger role. And depending on some things we're looking at, and I'm sure there's a way to word it. That happens all the time with jobs. Contingent upon something. This
Sure.
could happen or that could happen. So that's not that unusual, and I think it would be a positive for the applicants.
And I think getting people to come in and have a conversation begins the discussion, and they may want to wait until they know about the grant, but that's fine too.
Yeah.
Kevin, were you going to say something?
Yeah, I agree with all of you. I think, having that potential there could actually attract more candidates for the position. You can write it, it can be just simply written up as the health director of the town of Reading with the potential growth for a 3-town collaboration.
Yep.
And I think, if there's folks that can word that line correctly to really pop off the page and kind of grab somebody and say, "Ooh, there's something going on over here."
Yep.
Right. So I think it's definitely worth it.
Yep.
To list it as such.
And if I just, Jean, I'm remembering you said something that Linfield is very eager to talk about this. Is your sense that they would be wanting to continue the conversations of how this works, even if the grant didn't go through? Can you say that? Am I asking?
I'm going to say that they're very interested.
Yeah.
I'll leave it at that.
Fair.
Yeah. Yeah,
So-
I would suspect so.
Yeah. Okay.
I would
Lots of
expect
moving
that.
parts.
Yeah,
Yeah.
I'd expect that even if without the grant, there could be some kind of back and forth.
Interest in exploring opportunities for collaboration.
Yep.
Okay. Okay.
May I offer one simple thing? Through you, Dr. Chair, the grant does talk about a shared services coordinator. And so it might be that the next health director is just going to be managing one more person who's going to be managing the shared
Yep.
services across lines.
Yep.
That's right.
And
Yeah.
I mean, I'm almost out of school talking here, and I don't ever want to do anything behind that would undermine Jean's thoughts without having beat her up on our own space first, at least. But, this, I don't see this as being something that we need to hesitate, not for a single moment.
Mhm.
Could I also offer the piece about the Danvers piece where the person who took my place a year ago, he's not there. And for whatever reasons, he didn't grow into the job. That was the official word from the town manager in Danvers. And 3 days later, one of the candidates they interviewed a year ago was very happy to leave the assistant position he was at. It was either Somerville or Watertown or something. I'm not positive of all those details, but someone's starting next week in the town of
Wow.
Danvers. So with the right environment, there's people that are ready to make a lateral move
Yep.
to do something more attractive towards their career in public health.
Yep.
I said something to that effect before.
Well, this would be a
Jerry,
little bit of an upward move too, though.
Yeah.
Could be, yeah.
Absolutely.
I think there's a lot to.
Yep.
Jerry, you're on board with this as well?
Yeah, I think we shouldn't wait if we have the green light from Bob.
Yep.
So why don't we ask Jean to go back to Bob and whoever HR and convey the sense of the board about the urgency of posting this position and getting started. And, you know, I can follow up with you in a few days and see where we are on that.
Okay.
So, in a related issue, we've talked about this idea of doing an internal analysis, and this is like a 3D chess game. We talked about doing this internal analysis to look at the Reading Health Division and what is its strength, weaknesses, what we need to do to improve it. We talked about doing this potentially, if we could get a new health director quickly, to do it in concert with that person. But on the other hand, if it looked like that was going to be a long process, maybe we would do it in any case, and at least the analysis would be done. And now we have yet another complicating factor of the grant, which is if we were to do this analysis, would it be to look at a 3-town, what a 3-town program should look like? Probably, if we were to get the grant. If we weren't, it would revert to our original thinking around the town of Reading. So there are a lot of moving parts in this decision. And then there's also the issue of we didn't get a whole lot of requests back from our RFP of interest, and except for MAPC. And so Peter, Jean, and I have talked a little bit about what an option could be, because the other, yet even more complicating factor is these funds are available but need to be dedicated by June 30th. And so if we're going to move on this, we need to move on it. So Jean, I think you had some ideas about how we might approach this.
Yep. The easiest way to basically get some outside help on board is through an interlocal agreement, which we are able to do with somebody like MAPC. And that does not require any procurement process because it's from one form of the government to another. So it is not subject to the Uniform Procurement Act, Mass General Law 30B. Shuang and I were talking a lot about that over email. But we don't have the procurement rules that we would otherwise with a non-governmental entity. We can enter into an agreement, a contract for services. And where MAPC did express interest and did respond to the initial RFP, that would be one option to consider, and one that you could do fairly easily and quickly, and be well within the time frame of having the money committed by June 30th. we do this kind of thing with them all the time. So that's an idea. You know, I think at one point we had talked about bringing them back in and getting a better sense of how they might approach something like this and figuring it out a bit more. I think you're on mute, Rick.
You're on mute, Rich. Rick?
Rick, you're muted.
I'm muted now. So there was a concern raised, I think, by Carrie about, you know, their expertise in public health. And one of the things we talked about would be, and maybe this could be part of a conversation if we brought them in for a presentation, would be that we would ask that they subcontract with an acceptable public health expert in the field as part of this arrangement, so that we know that they might do a lot of the logistics and coordinating and interviewing, but they would be engaged with a subcontractor in public health who could ensure that the value of the analysis is something that we would be, you know, happy with. And that would help resolve the issue of, you know, if there's concern about their public health depth and expertise. So that was another part of this. And so what we were thinking about was potentially having them come in either at our next meeting or the meeting after, ideally the next meeting, if they're available. And, you know, have them give us a 30-minute presentation of how they would approach this, what they would, you know, how they would approach it, what they would want to see come out of it. And we could raise with them, maybe we could raise with them beforehand so they can think about it, but we could raise with them the idea of, you know, subcontracting with a public health expert that we're comfortable with, and to help do the work. So that's kind of, I think, where we are. And probably by the time, if we have that presentation and we talk about it at that meeting or a subsequent meeting, we would, by the time they engaged, I think we would know the results of the grant. And if we were going to get the grant, that would be, you know, the scope would be looking at that 3-town project. Thoughts? Yes, Carrie.
Thanks for raising the issue. You're right, it's complicated, and thanks for the thoughtful discussion of some of the alternatives. I have a couple of things. First, I'm going to suggest that I think the scope still, for us as Reading and serving as the Board of Health for Reading, I believe that the scope ought to by rights remain considering what does Reading need, because our intent with this was to identify what are the standards, what are the things that we want for the community of Reading for public health. So I would lean more towards keeping it within that and allow the grant to fund the considerations of what does then that 3-town collaboration look like.
Good point.
So that's one thought. My second thought is, I think that in light of all of this, it makes it even more important that there be actual public health experienced experts on board. I just, if you haven't run a health department, to come in and do an assessment is I'm just not sure what the utility of it would be. So I love the idea that we have them incorporate someone who has experience and that they, understand that that's a collaborative relationship and an opportunity for them to expand their service. And I'll say again, MAPC is great. They do great public health adjacent work. But I have not seen anyone and they may have added folks. I'm not checking their roster all the time. But I have not seen anyone in their roster that has direct on-point experience. And I think especially as we're thinking about expanding, we want to make sure that we do it right. So those are my thoughts.
Okay.
Yeah.
It's a good point. Other thoughts, comments?
Could I just state real quickly that, let's see, Mark Fine has a place mark on the 15th for 7 o'clock or so. He's MAPC. I just talked to him, or we communicated, I guess we were on a chat line thing. And he said he would hold it. And I said I'd get back to him after tonight's meeting. And if it pleases the board, we'll, it's up to you to put it on the agenda. I'll get him here.
I think we should.
Yeah.
Now the 15th is our next meeting. And I like the idea of continuing to limit it to Reading. Makes a lot of sense and not confuse the issue. And I know that a while back, at least I was told, I think that maybe Carrie or Peter or both you have some ideas of what public health experts are out there who might be useful. And I guess we should hear from MAPC about their willingness to engage a subcontractor. But Peter, you might want to give them a heads up that that's what we're thinking about. So they have a little bit of time to noodle that, and so they're prepared to answer it. But what we'd want to hear, and maybe again, Peter, you could bring this back to them, is, as I said, what they would see the engagement looking like in terms of process and outcomes.
Got it.
All right. Okay, so that's on for April 15th.
Awesome. I mean, I think it's great. I'm glad they want to come talk to us. I'm interested to hear what they would have to say. So
I think it'll be good. All right, moving on. COVID updates. Case counts. I don't know who's. I saw the case counts come out. They got posted.
Yeah,
Is that-
I have Christine's. It's comprehensive, more than usual. And let's see if I can share a screen on this one.
Only if you can get out of screen share.
Not really. Pop it open and let's see. Share screen. That's it. Yeah. So that's
Jackie, I think we're going to make your cats honorary members of the board.
yes.
It's okay with me. I like kitty cats.
The host.
They'll take over is right. So this came from Christine today. Wait a minute. The 7 o'clock part was she couldn't make it, so she sent out the COVID data. And as of yesterday, our total count, as you can see, and I hate just reading 1770, the active is 74 deaths, 49, transfer of 10, recovered 1637. That's a large recovery rate to me. Maven is down until 7:30. Let's see, there are 12 new cases over the past 2 days. Sorry, can't make it, but let's see. I'll have any questions we have, I can get to her and she can get back to us if I can't field them right now. Maybe Schwan can help. So this is a list of things that she has been doing. She's been very active in networking. So, keeping us ready and in line with commanders big time, attending Maven updates through webinars is ongoing. The CTC, she has her contact there, Sandra Aronson, and we haven't really relied on those folks yet, and hopefully we don't. She is still working with Boston Prep. I could talk some more about that if that ever came up. And Mary Giuliani, I know, is the lead school nurse, and she's been really I've never met with her, but she is incredible. Lady spends a lot of time helping us on that. There's a roundtable with CTC and youth sports coming up, and I'm amazed at what's going on. I read that Salem News and watching football players smashing heads, and they're, what's going on? And that's just a sideline, but let's see, number 7, COVID dead as well as other communicable diseases in the community such as Lyme, Hep, foodborne illness. I will have an update for 4 p.m. health department meeting today. She didn't get that off to us, I don't think, but we'll get that. I don't get the feeling that, it's unusual that we get nothing. But of course, with COVID, and this time of year, we would be flooded with the flu. Influenza just doesn't exist. So, that's those are her remarks for today. I have a couple of others too. I'm going to stop the share now. And get better.
Yep. Good job.
It happens. When I was at my regional meeting on every Tuesday at 8:30, Wilmington talked about some of the new cases they're getting, including, I don't know if anybody's heard of this. I'll be a little dismayed if you have, because it took me by surprise that a whole family was positive COVID, including the pregnant mom, who was anxious that she might get the disease as she was getting ready to give birth. Instead, she gave birth, and the child was born COVID positive, asymptomatic. And I mean, I thought the placenta was doing something about screening those viruses, and maybe I'm wrong. And I even think that this lady had been vaccinated, and that was supposed to protect the child, and maybe I'm wrong, but that's new.
Yeah.
In Wilmington, there's a bunch of cases. No, throughout the region, the cases are rising exponentially in kids on these variants. And I'm not having a good time repeating this message that, we had a bad year. We saw a lot of people succumb to this disease. We don't have a clue on how horrible this will be until it affects our children, and we're helpless around that. So if that is not motivation enough, to let's keep it going strong. By that I mean the mask up and the backs up. I don't know what is. And that's the nurse's report on COVID.
Yeah.
Okay. So yeah, I noticed the state numbers keep rising. It's, I don't know where this is going. There's a lot of controversy as to whether it's the start of another surge or it's just low-grade variant activity.
Yeah, it's hard to know. I know. So anecdotally, I'll say Tufts, where my son is, they have seen an increase in cases, and they've moved back to every other day testing. They, decided they needed to have that in place. And I mean, I personally, I'll say I saw a ton of activity the weekend before St. Patrick's Day. Good weather. I think a lot of people were out. People were feeling happy, and that's great. But it's still that message of this is still here, and even with the vaccination happening, this is still here. And so now we're 2 weeks past that pre-St. Patrick's Day weekend, and cases are rising, and we're in the midst now of Passover and Easter, approaching Easter, and those are big times for people to gather. So I just hope that people will be able to continue to do so safely. And I hear folks talking about these variants as well, and the worries of whether those gain a foothold ahead of the vaccine curve are very real. So
in terms of vaccines, did we just have we just held another vaccine clinic at the Pleasant Street Center?
Tomorrow, correct?
Oh, is that tomorrow? Okay.
Well,
Yes.
if it pleases the Board of Health, let's let Schwang, I'm sure she came well prepared to talk about all the activity that's going on. And there is a great deal of activity going on with vaccine right now. So Schwang, would you
Okay.
mind?
Before we get to that, just
Yes, sir.
really
Yeah.
quickly on this subject, if you don't mind. So I know the schools are going to continue doing pool testing for, is it through the end of, or leading into vacation, but not after? Or is it going all the way to the end of April? Does anybody
I thought
remember?
the state initially said like 6 weeks or 8 weeks or something, but then I thought I read that they extended through the end of the school year because it was so successful.
They did. Okay, good.
Yes, that's my understanding as well, Rick. Yeah.
Okay, all right, good. I just wanted to, I wasn't sure on that. And that just to your point, Peter, about, it doesn't hit you until it hits the kids. That pool testing seems to be doing, catching a lot of early cases, which is good.
Yep.
So that's good to hear that they're going through the end of the school year. Okay.
I just saw communication from the school trying to encourage more families to join the pool testing. So that's also good.
Mhm.
Oh, right, because that's, yeah. It's funny that you say that, Jerry, because I was just sitting on the school council at the Wood End for my kids' school, and you're right, the numbers of the opt-ins are pretty low, and they've actually had a lot of people that originally opted in go ahead and opt back out.
Oh,
Really?
Yeah. So maybe there's a role here from a communication standpoint from the Board of Health to the community in regards to that. Thank you for bringing that up, Jerry.
have to give that some thought. I can imagine the school department has been pretty aggressive in encouraging testing, getting consent and so forth.
Yep.
Yeah. Right, Shang?
Okay. Thank you, Dr. Lopez. I'm just gonna share my screen. Okay. So can you see my screen?
Yes.
Great. So today I will talk about some updates of our COVID vaccine clinics and vaccine order and delivery. I will also share with you some information regarding the federal and the state vaccine allocations from the interagency local board of health meeting I attended this Tuesday. So here is our COVID vaccine clinic updates. And last week we had 3 clinics. On Tuesday, we had vaccinated 81 individuals in affordable housing, 44 in Frank Tanner, 37 in Cinder Glen, all first dose. And on Friday, we vaccinated 89 Reading residents in phase 2 for their first dose. And as of last Friday, March 26th, 164 individuals in phase 1 were fully vaccinated in our clinics, and 326 phase 2 recipients received their first dose, and 116 of them were fully vaccinated. So to last Friday, we administered 489 first dose and 280 second dose. So we totally admin 769 doses, and they are all Moderna vaccines. 634 doses, that is 82%, were administered at regular clinic, mainly at Pleasant Street Center and 1 clinic at Reading Memorial High School Field House. 81 doses, 11% were given at Frank Tanner and Cinder Glen Affordable Housing on last Tuesday. And for 54 doses, 7% were used for homebound individuals. And tomorrow, we will have 2 clinics at Pleasant Street Center. The first one is second dose clinic for 23 Reading residents who received their first dose on March 5th. And the second one is first dose clinic for the Council on Aging plan. We will also deliver 14 second dose to the homebound individuals who received their first dose on March 5th. Meanwhile, recently, Town Hall Fire Department and Senior Center received some calls from Reading senior residents to inquire about the COVID vaccine clinic. So we hope the eligible people could be vaccinated tomorrow through the Council on Aging plan. And this is our COVID vaccine order and delivery updates. Since March 17th, we have not received any new vaccines. This week, Peter ordered 200 second dose from the state for affordable housing and Reading Council on Aging plan. In addition, according to the state, 70 single-dose Johnson & Johnson vaccine shall arrive early next week for homebound vaccination. And this is regular federal and state vaccine allocations updates. So currently, the federal strategy for vaccine allocations is to prioritize the vaccine to retail pharmacy chains and federal qualified health centers. The Biden administration announces to increase vaccine to meet an objective of a vaccination site within 5 miles of 90% of all Americans by April 19. So the administration will increase the current number of pharmacies giving out vaccines from 17,000 to 40,000 within the next 3 weeks. And the administration is adding 12 more federally run mass vaccination sites across the country. But as of this Tuesday, the state was not seeing an increase in doses allocated to Massachusetts from the federal government. So if the federal government increased the state's vaccine allocation, they will distribute vaccine to the local sites. And from yesterday's news, more than 100,000 doses of Johnson & Johnson vaccine are coming to Massachusetts next week. At this time point, we have no idea about state allocation plan. And thank you so much. Do you have any question?
Any questions?
Nope. No, thank you, Shuang.
That's very
Yeah.
helpful.
Thank
Thank
you, Shuang.
you.
And Shuang, thank you for bringing in the content from that Tuesday meeting. That's helpful for people to understand. So that was great. Thanks.
Sure, thank you.
Carrie, any updates from Incident Command? Has there been an Incident Command meeting?
Not this past Monday, not this week, been a long week. But but we did meet the Monday prior. The discussion then was largely around school reopening. They're on target for April 5th, and they were happy. They were feeling very positive about the testing that was happening. As we know from past reports, it seemed like athletics in the schools was a contributing factor or a factor in cases, and that's where we're seeing a lot of having to quarantine folks. So the athletics are required to, required to test. So hopeful that that strategy will bear out and we can catch the early cases and prevent kids from getting sick and prevent them from spreading it at home to their families, known or unknown. So that was a positive from that. We also talked about the homebound vaccination program. I think I've said this before. Reading is a little bit ahead because we got out in front and identifying who the homebound folks were who needed some assistance in getting them vaccinated. The program that the state has is a little bit narrower and a little bit trickier to get folks qualified for. So it was nice work that we were able to vaccinate some people ahead. And those were really the highlights. I want to, if I could just add two things at this point that are COVID related. First off, there is a vast network of people out here in the community who are donating their time, who have figured out the registration systems for the pharmacies and the state and all the different vaccination sites. And they're donating their time and helping people, not just their family or friends, but anybody, book appointments and getting them access to the vaccine. And I get reports of it all the time. And I'm so grateful and I'm so proud that, there's people are just stepping up and using their free time and their knowledge to support our community members. It didn't have to be like this. Didn't have to be like this, but since it is, it's lovely to see that the community is able to support that.
That's great.
Yeah,
It's great.
yeah, it's something I've heard about. I don't know if other folks have heard of, and I want to make sure that we highlighted it. Yeah, and say a big thank you to anybody who's doing it. And then the other thing I wanted to highlight is, so I've talked before about how in emergency preparedness, your recovery phase, a key piece of the recovery phase is community resilience. And I was asking Kevin, is there anything the coalition's doing, this sort of broader community initiatives? Because we want to try and encourage community resilience. And I guess the library and the Cultural Council are sponsoring something called the Pandemic Peace and Promise Photo Project. And they're accepting photo submissions through June 4th to build a digital archive of photos that people took during the pandemic of things that, brought them peace or brought them, that were meaningful to them of the pandemic experience. And they want to, build this archive and have it be available as a resource to the community and to capture something. And I just think that it's wonderful. I think it was another, community member who kind of cooked up the idea with some other creative people. And there are a lot of wins. It's hard to find the good things that happened in this pandemic, but there are things like that. I think there are things that we want to celebrate as well as acknowledge the challenges and how we got through them. So I wanted to highlight that. I actually even know there's an email address. If you have a picture, there's something special for you. It's pandemicpeace@gmail.com. So.
Okay.
Yeah. Thank you for.
That sounds interesting.
But yeah.
Thanks for sharing that. That's
Yeah.
fascinating. Huh. So, and in terms of civic and recreation permit issues, I presume, Peter, everything's going smoothly and nothing.
Really it has. A lot of these have been processed and some have been turned away. The road race, we're working with the sponsors on that. They think they can do a road race and it's not time. On the other hand, the scouts are still doing, and I know we heard one night here that there was, I think it was in this venue, that there was a little incident with the scouts and a little outbreak. So just trying to tweak that a little bit, but the scouts keep doing it with their addendums in place and everything for the recreation department and the season is forthcoming.
Yeah.
I know they they didn't gain any popularity around pickleball, which is not one of my favorite sports for a few reasons, but they've been putting their foot down, and we're here to back them whenever they think it's necessary. And there's got to be some balance out there for sure, and I support all that as well. But when something just doesn't meet the specs, I mean, I can't see making exceptions. So I'm glad we have Rick to help us, go through these, comb through them, and pre-screen them. If you like that term.
Yep.
But things are going pretty swell.
Good.
Good.
That's great.
It's good to hear. So in terms of our next meeting on the 15th, we'll hear that presentation. Maybe there'll be some follow-up on the health director posting. We won't hear anything about the grant. One thought I had also was, for us to start thinking about at some point, going to monthly meetings. But I think it would be dependent on if we feel like we have a robust agenda, then we ought to have a meeting. If there's an urgency to something we have to decide, obviously we have to have a meeting. So, I would keep the time slots in your schedules.
Mhm.
But I think we may find, particularly heading into the summer, that, may not be a quorum, there may not be much happening. Peter has volunteered to, if we skip a meeting, potentially to just give an update on what's going on, through email as a interim step. I feel like, the meetings ought to match the work or the decisions that we need to make, not just to have meetings for meetings, but, and it seems to me over the last several months, we have been making progress and we have been doing good work. But, as things evolve, we'll just play it by ear. But I just wanted to kind of plant that seed, that, we ought to have meetings based on a robust agenda going forward.
Couldn't agree more.
Agree. Yep.
Great.
No
And just for-
meetings, just to meet.
Yes.
Yeah, and just from a historical reference in that regard, Gene, before all this, what were we generally like an hour and a half at like an hour and a half was a long meeting before this monthly, by the way.
It was
Like,
monthly, yeah.
it was monthly. So just from a historical reference,
Yeah.
in regards to that, I agree more. If there's no sense in meeting to meet.
Yeah, I tried to go on websites. A lot of the surrounding towns, their Board of Health websites are not as crisp as ours, or up to date. And you're trying to find agendas and you're trying to find minutes to kind of see, okay, how often are they meeting and what are they talking about? And a lot of them are meeting either once a month. I think through the pandemic last year, a lot of them were meeting twice a month. That wasn't unusual. Not twice a week, twice a month.
Mhm.
But there's a mix, but clearly the once a month is not unusual. If we get to that.
Mhm.
So on that note, I'd like to make a motion to adjourn. Do I have a second?
Second,
Roll call. Carrie?
aye.
Rick? Aye. Meeting's
All
adjourned.
right, great.
Thanks, folks.
See you, everybody.
Good
Nice
night,
meeting.
everybody.
Stay well.
Thank
you.
Have a
you.
good weekend.